We are very happy to be joined again by Debbie Lynn Toomey from Tufts Medical Center. Debbie, thank you so much for joining us.
Carrie, thank you so much. I am Tufts Medical Center's Injury Prevention Coordinator, and my work has to do with outreach and advocacy. And in this particular program, it focuses on aging strong, fall prevention, and stress management for the aging population. And I want to continue to really thank Quincy Public Library for allowing me to continue to do my work in this manner, and also Quincy Access TV, of course. Today I have a very special guest. She is a dear friend of mine, and she is the expert on the topic of diabetes. Her name is Sherry Keating, and she's the owner of Diabetes Care Consulting. Sherry, welcome. Thank you for being here today.
Thank you so much for having me, and thank you to the Quincy Public Library and to Tufts Medical Center for giving me this opportunity to share my passion and expertise with all of you.
Awesome. So I know you're going to be talking about pre-diabetes, but before you do that, can you just share with us a little bit more about you? Because I know by trade you are a nurse. How did you shift? How did you shift from bedside nursing to owning your own company and really specializing in diabetes?
That's such a great question. I have been a nurse in the field of diabetes and cardiovascular disease for the last 38 years, actually. And I actually started a diabetes self-management education program for a hospital. And after a 33-year career, I was laid off. And when I was laid off, I became a telephonic diabetic nurse. And then I was laid off a year later, and then I had enough hours to become certified as a diabetes care and education specialist. And then I actually found out diabetes type 2 was preventable. And it was like an aha moment for me. So I needed to learn more. I became certified through the CDC as a National Diabetes Prevention Program lifestyle coach. And I started my company because I figured if I've been in the field for this long, I didn't know we could prevent diabetes, then there are a lot of other people that didn't know. So my mission was to help people to increase awareness that we do have an epidemic of prediabetes and diabetes, and then to offer screening and prevention education.
Yeah, wonderful, wonderful. So you are the expert, I would say. I can't wait to really learn more and have you share more about your knowledge on prediabetes. So can you just talk to us about, and I know we're not doing slide share, we're just going to do a conversational type program here today with you, which is awesome. And whoever is joining us on Zoom or even live stream via YouTube, please feel free to type in any questions that you may have, because that's going to make this this hour really more robust. So can you share what prediabetes is? Because I really, honestly, I've never heard of it until I heard you talk about it in one of your workshops. And so can you just let us know what that is? And so yes, please.
Absolutely. So I hadn't heard of prediabetes either. So prediabetes is actually an early stage of insulin resistance. So what does that word mean, insulin resistance? Insulin is a hormone that's produced in specialized cells in the pancreas. Its job is, picture it as a key to unlock our cell doors to allow sugar that we've created from the food that we eat to enter the cell and to be used as fuel in the cell for the cell to do its job, and also to regulate the amount of sugar that's floating around in our bloodstream. So we need insulin in order to unlock the cell door for sugar to enter the cell and not accumulate in our bloodstream. When we have insulin resistance, those cells in the pancreas are still making insulin, but when it comes time to unlock that cell door, it isn't able to do that. And because of that, the sugar does not float into the cell. Instead, it floats around our bloodstream and it starts to attack our blood vessels. And so this process, Debbie, takes a long time to occur. It's happening inside of our body, and we don't even know that it's going on. And so the longer we have prediabetes or insulin resistance, the higher risk that we have of developing type 2 diabetes. So really, prediabetes is a precursor to developing type 2 diabetes. It is a disease of insulin resistance where our pancreas, the organ that makes insulin, is making insulin, but it is unable to be used by our body cells properly. So our sugar cannot do what it's supposed to do, and that's enter the cell. Instead, it accumulates in our bloodstream. Now, we don't feel different. We don't have any symptoms, but what happens is there's things going on behind the scenes in our body. Our body tries to produce more insulin so that the insulin will be effective and we can get the sugar to go in the cell instead of accumulating in our bloodstream. But it eventually, after years of trying, it can no longer do that. And then we start to see our blood sugars go up, and we literally can go to the doctor and they will measure our blood sugar and it will start to show that our blood sugar is elevated. But that process can take 10 to 20 years. And we don't even know that we have pre-diabetes, which really is a thing. And we don't even know we have it because we don't have any symptoms. And all of those years that this is happening, where our blood sugar is slowly elevating and starting to attack our organs and our body, we feel fine. We don't have any side effects. Our blood sugar, when we go to the doctor, is normal, but the damage is starting to be done. So if we don't do something when we have pre-diabetes, we will go on to develop type 2 diabetes, and we will go on to develop the complications of diabetes.
Wow, that's amazing. So it takes years. We don't know what's happening.
Yeah.
So how can somebody prevent pre-diabetes so that way they're not in that journey of being diagnosed or suffering from diabetes, in the long run?
That is such a great question. And how I would answer that would be, we have to first have a conversation about who's at risk for prediabetes. Because if you are a person that's at risk, then you should be tested, because we don't know that we have prediabetes because this is silently going on in our body for years and our blood sugars are normal. So we have to talk about who's at risk for prediabetes. So first of all, the number one risk factor for prediabetes as well as diabetes is obesity. So if anyone is overweight, especially around the belly. So when we carry, so think about an apple, think about a pear. An apple is round in the middle, right? A pear is rounded at the bottom. If we could choose a body style or type to be, we would want to choose a pear versus an apple. Because an apple, when we carry our weight around the middle, like around our belly area, we're literally increasing our risk of not only diabetes, but of all the associated health conditions associated with diabetes. What happens to that excess weight around the belly? It actually acts as an endocrine organ. It causes inflammation throughout the body. It can lead to a fatty liver. It can lead to heart disease. It can lead to strokes. We don't want to carry our weight around the middle. So if we have weight around the middle, we want to try to work on weight loss. So number one risk factor is being overweight, especially around the belly. Okay. Number two is anyone over the age of 45. So if you're over age 45, you should be tested for diabetes, prediabetes. If you have a mother, father, sister, or brother who have had diabetes, you are at a higher risk, okay? It's not your uncle or your aunt. It's your primary relative, so mother, father, sister, brother. If you have a history of heart disease, even if it's under control, you still have a high risk of diabetes. If you have a history of elevated cholesterol or elevated blood pressure, you are at a higher risk of diabetes and prediabetes. If you had diabetes in pregnancy, so women, when they're at week 24 to 28 in their pregnancy, the hormone stresses the pancreas, the organ that makes insulin, and it increases the ability of their pancreas to use the insulin properly. So they can become insulin resistant and develop diabetes in pregnancy. Most of those women, when they deliver, I would say 95% of them will no longer have diabetes once they deliver and their hormones go back to normal. But if you had diabetes in pregnancy, or you delivered a baby that was over 9 pounds, you do have a risk of having diabetes later in life. So that's another risk factor. If you smoked, or are smoking. That's another risk factor. And then there's certain ethnic groups like African American, Asian, Latino, Pacific Islander. Those are type of ethnic groups that are at higher risk of having diabetes. So the risk factors for prediabetes are the same as the risk factors for diabetes. Okay. And so if you have any of those risk factors, you should, and the last one is you're inactive. So if you're not exercising on a regular basis, that's another risk factor. So if you have any of those, then you should be tested for prediabetes. It's a simple blood test. Because you don't have symptoms, unless you actually get tested, you're not going to know. And the good news is that it's reversible. You can prevent yourself from moving on and developing type 2 diabetes by doing 2 simple proven lifestyle changes that we'll talk about in a few minutes. So getting tested is the most important thing. Knowledge is power, because if you know that your blood sugars are elevated, but not high enough yet to be diagnosed with diabetes, that is the time that you can reverse the process by doing simple lifestyle changes.
Okay, so let me just before you move on and talk about the blood test, I just want to go over the risk factors again. So you're saying, well, there's a lot. There's a lot.
Yes,
and
there's a lot of
people
risks.
who could be watching this, maybe nodding their head. Over 45, yep. Family history of diabetes, yep. High blood pressure, yep. So you said people who have obesity, especially if they have a lot of belly fat, which is associated with a lot of organs, fatty liver, like fatty organs, right?
Yeah.
And then a familial history of diabetes. And is that diabetes type 1 or type 2, or does it matter?
Type 2.
Type 2. And diabetes type 2 is something that gets diagnosed once you're not born with it. It's something that you end up getting based on lifestyle and the risk factors, basically, that you just shared with us, right?
So to clarify that, type 1 diabetes used to be a disease of childhood. We called it juvenile diabetes. And usually it's due to an immune problem, and you literally no longer produce insulin from your pancreas. So that used to happen when people were children. Now, older people can develop type 1 diabetes where their pancreas no longer produces insulin. Now, type 2 is the most common. 90 to 95% of people have type 2 diabetes, and that is usually lifestyle related. Okay. Now, the sad thing, Debbie, is it used to be a disease of adults, but now it is trickling down to our adolescents and our young adults. So because of lifestyle, now, actually, for prediabetes, 1 in 5 and 1 in 4 adolescents and young adults now have prediabetes. So this is actually a health crisis, not only for adults, but for adolescents and young adults as well.
You said 1 in 5 adolescents?
1 in 5 adolescents and 1 in 4 young adults actually have prediabetes, and 1 in 3 adults have prediabetes. So we have 88 million people that have prediabetes. 1 in 3, and almost 8 out of 10 don't know it, because unless you're tested for prediabetes, you don't know that you have it because there are no symptoms. So,
Wow. All right. So let me continue down the list of the risk factors. I'm taking notes. Notes here.
Good.
High blood pressure, you said. High cholesterol. Ladies, women who were pregnant 24 to 28 weeks, they had what's called gestational diabetes, right?
Yes.
So they're at risk. And also, especially if they delivered a baby that's greater than 9 pounds. Ouch. All right. And if they have a history of smoking, or they are still smokers, and also various ethnic groups, African Americans, Asians, Latinos, Pacific Islanders, and also, of course, lack of activity, people who are sedentary.
Yes.
So now you're sharing with us, you were about to share a blood test. Is that the A1C?
So to diagnose prediabetes, it's the same test as you would use to diagnose diabetes, only the results are different.
Okay.
So there's two tests. There's actually three, but there's two tests that people would be tested for, one or the other. One is called a fasting blood sugar, where you would just fast 8 hours, and you would go into the lab at first thing in the morning, they would do your blood test. Okay. And so if your fasting blood sugar was between 100 and 125, you would have prediabetes. Over 126 is diabetes. Okay. Now, the other blood test is called an A1C, a hemoglobin A1C. And what that means is we're measuring the amount of sugar that's accumulated on your red blood cells over the life of the red blood cell. Your blood cells live 3 months. So we can tell by every 3 months how much excess sugar has been floating around in your bloodstream on your red blood cells by doing this A1C test. That's why people who have diabetes, every 3 months, they'll have this A1C test, because we can tell a lot of information about how well they're managing their diabetes and how well the treatment is working by measuring the A1C. Same thing by checking to see if you have prediabetes, how much sugar has accumulated on this red blood cell for the life of the red blood cell. So it's like taking a camera snapshot looking backwards. You don't have to fast because it's a 3-month average. The result comes in a percentage. So if you are 5.7 to 6.4%, you have prediabetes. Anything over 6.5% is diabetes. So those are the two blood tests. So anyone that has those risk factors, testing should begin at age 45 or younger if you have risk factors that increases your risk of type 2 diabetes. So
wow, very, very good to know. So I love how the A1C can't, some people, when they're about to see their doctor, they start eating a little bit better so that their fasting blood sugar is better and their blood pressure is better and their weight's a little bit better. But the A1C, it really can't lie. It'll really reveal what that person's been doing.
Yes. And let me add something to that A1C. Because it's measuring the red blood cells, if you have a health condition that affects the red blood cells, so if you're on dialysis or you have anemia, or you have HIV or pregnant, that is going to affect the A1C. Anything that affects the red blood cells is going to affect the A1C. So the A1C is not the appropriate test for someone who has a health condition that affects the red blood cells.
Okay.
They would need to have a fasting blood sugar.
Okay. So people, you said anemia, like sickle cell anemia.
Anemia, yeah, sickle cell anemia, dialysis.
Yeah. Okay.
Pregnancy, HIV. So any of these things that will affect your red blood cells will affect your A1C test results. So that is not the test that you should have to either be diagnosed with prediabetes or type 2 diabetes.
Okay. So now you also mentioned that it's becoming more of it's not just a disease or a condition that older adults get. You're saying that adolescents are being affected, young adults are being affected. Why is that? What do you think is the cause of that?
I think it's lifestyle. If you think about how sedentary we all have become, and when you and I were kids, we would be outside playing. We would not be on electronics. We would not be sitting down. And I think electronics have a lot to do with it, because we are now in an age of electronics, especially since the pandemic. And we are now on Zoom for all hours of the day, and children are being taught, via computers, and they were homeschooled, and they were, on Zoom for hours themselves, and they don't go out. And there's a lot of different family dynamics today. There's a lot of, there's more safety issues with people going out and just letting their kids go out. And I just think the world is different. And because of that, I feel like kids are now getting high blood pressure. They're getting elevated cholesterol. They're overweight. Our diet is terrible. We supersize everything. And so I feel like there's a lot of factors between our sedentary lifestyles, our the age of electronics, the family dynamics, two working parents, what we are eating, fast food. There's a lot of variables, and I think that it's really causing havoc on our health.
Yeah, definitely a lot of variables. I remember when I was little, if I was sitting down and my mom was to see me sitting down, she'd think I was bored.
Yeah.
And she'll have me get up and start cleaning out the refrigerator.
Exactly. I mean,
go to your closet and clean that.
We were never sitting. I came from a family of 8 children, and trust me, we were never sitting, and we were not on electronics, and we always had, responsibilities, and we were out playing until dark. And, it's a very different world that we live in. And because of that, we have to really think about what we're doing in terms of our lifestyle habits, because everything goes back to lifestyle, and diabetes and prediabetes is really connected to so many other health conditions. It's connected to heart disease. It's connected to stroke. It's connected to eye disease, kidney disease, nerve disease. As a matter of fact, cancer, Alzheimer's disease, dementia, hearing loss, that chronic elevated blood sugars that we have going on for 10 to 20 years before we even diagnose with diabetes is really attacking our small and large blood vessels. And a lot of times, people don't even know they have diabetes. They go to the eye doctor for a routine eye exam, and the doctor tells them they have bleeding or retinopathy in the back of their eye. And they asked if they had diabetes, and the person says no, and the doctor tests them for diabetes. And in fact, they developed the bleeding in the back of their eye because it was a complication of having chronic elevated blood sugars. And so people will go to the ER for a heart attack, and they will ask them, do you have diabetes? And they'll say no, and they'll test them and they will have diabetes. So the point that I'm trying to make is because this process takes 10 to 20 years, a lot of people develop the complications of diabetes before they even get diagnosed with diabetes because of the process taking so many years, and people feeling perfectly fine and their blood levels being perfectly fine until eventually the pancreas can't keep up with the demand anymore. And we start to burn out the cells that make insulin, and we start developing elevated blood sugar that can be tested and be diagnosed as prediabetes or type 2 diabetes.
Oh, wow. So how can we take care of it? If I don't want to say lucky enough to find out that we're pre-diabetics, which actually in a way, if you are on that path, it's good to be diagnosed. So that way you can be given choices and also instructions on how to keep that from worsening into a diabetic, full blown being a diabetic. How can people, once they are diagnosed, what can they do to get rid of it, to lessen their chances of having it be more of an advanced form of diabetes?
So this is the situation. There was this amazing study called the Diabetes Prevention Program. And what happened in this study was there were over 3,234 people that all had prediabetes. There were men, women, different ethnic groups. They were all overweight. They all had prediabetes. So the goal of the study was to see what we could do to prevent them from converting to type 2 diabetes, because once someone is diagnosed with type 2 diabetes, 15 to 30% of those people will convert to, once you're diagnosed with prediabetes, 15 to 30% of those people will convert to type 2 diabetes within 3 to 5 years unless they make some lifestyle changes. So the Diabetes Prevention Program study actually showed that they had these 3,234 people. They put them into 4 different groups because they wanted to see what intervention that they could do to prevent them from converting from prediabetes to type 2 diabetes. So one arm of the group went into intensive lifestyle management. They met with a social worker once a week. They were given a weight loss goal of 7% of their current body weight. They had to eat low fat, low calorie. They had to exercise 150 minutes a week. And they were given a lot of hands-on weekly intensive behavioral modification. So that was one arm of the group. The next arm of the group, they were given a drug that's the most common drug given to people living with diabetes called metformin. They were given metformin twice a day and they were given papers about, well, you should eat healthy and you should exercise. But they didn't get that intensive lifestyle. They didn't have a weight goal. They didn't get taught what they should eat. They didn't get taught what to do for exercise. They were just given, information and put on metformin. Then the other arm of the study was another diabetes drug called Resolin. But that arm of the study, they actually developed some liver problems. So they stopped that arm of the study. And then the fourth group was on a placebo, and they were just given some information, just like the group with metformin, paper about they should eat healthy and exercise. What they found, and they stopped the study because it was so significant, was that they found within 2.8 years of doing this study, they found the people that were in the intensive group who met with the social worker, who lost 7% of their body weight by eating healthy and exercise, they reduced their risk of developing type 2 diabetes by 58 to 71%.
Wow.
It was huge. So that study really was the basis for the CDC's National Diabetes Prevention Program. And they rolled out this program so that everyone could benefit from this program. And they don't do the one-on-one social worker weekly visits. It's done with lifestyle coaches like myself. I'm one of the life coaches for the National Diabetes Prevention Program, and they're all over the country. So if you are diagnosed with type 2 with prediabetes, my recommendation is to go and look up the National Diabetes Prevention Program and get involved. You have a lifestyle coach who will facilitate the group. They will teach you what to do in terms of diet and exercise. They will give you the support. You'll be in like-minded group of people. They do it virtually. They do it in person. They do it at YMCAs. It is a life-changing course. And with the pandemic, they've done telephonic, they've done virtual. So there's a lot of different options of delivery now. It used to be in person, but with the pandemic, it's changed. So I would say the first thing that you should do if you are diagnosed with prediabetes, number one, is to look up your nearest National Diabetes Prevention Program and get involved. Insurance will cover it, and you should get enrolled in that program. And then the second thing that came out of the this study was that losing 7%. So the secret sauce is you lose 7% of your current body weight. So you can easily calculate 7% of your current body weight, and that will be your weight goal. So it's not like I'm telling people you have to lose 50 pounds, 100 pounds. 7%. So if you weigh, 100 pounds, let's just use 100 pounds, you have to lose 7 pounds. If you weigh 200 pounds, you have to lose 14 pounds. This is not unachievable. This is achievable for every single person. So losing 7% of your body weight, cutting down on saturated fat, which is the bad fat. We can talk about what that means. And then exercising 5 days a week for 30 minutes at a moderate pace. So can I talk about those, the eating and the exercise piece, Debbie, a little bit more? Because I think.
Yeah, I just want to reiterate. So basically, the people from that study they were talking about, it showed that having an accountability buddy in the form of a social worker is very important. And basically, it's having a direction and a goal and having somebody really coach you and support you along the way.
Yes.
Right. And so a weight loss of 7% of the body weight, and it doesn't have to be like, being the biggest loser and weight, losing 100 pounds, right? So just something realistic, 7% of your current body weight, and reducing saturated fat. So making sure that you don't have to be a nutritionist, but being really well informed about the good fats and the bad fats, correct?
Yeah.
And moving more.
Yes. So sitting less, moving more. Yes. And what they showed was a moderate pace. So like a brisk walk. And the good news was that it's 5 days a week for 30 minutes, but the science shows the same benefit by doing 10-minute increments 3 times a day. So if you don't have 30 minutes, you can do 10 minutes of a brisk walk in the morning, in the afternoon, in the evening, and get your 30 minutes that way. And you're still going to get the same benefit. They found under 10 minutes is not really effective. You don't have to run a marathon. You got to get your heart pumping. So that's why they say a moderate pace, which is a brisk walk. Yeah. And you will also
One second. So I don't mean to interrupt, but just because this is a falls prevention stress management program, so I just want to reiterate that brisk walking is all subjective. Brisk walking for you, Sherry, you are an avid walker, is going to be different for somebody like my parents' age. So whatever you think is a walking pace that is steady, that's going to allow you balance, coordination, confidence, but still having you kind of, feel like you're breathing a little bit, but not hyperventilating. And of course, if you have any type of assistive devices like a cane or a walker, brisk walking, that's something you should actually be cleared for by your physical therapist or primary care doctor. Always know your body, but again, I just want to reiterate that brisk walking is all subjective, and keeping yourself safe is very important. Yeah,
I appreciate that. So, and to add to that, brisk walking means that you're just really getting your heart rate up a little bit. So it's not racing, you're noticing your breathing is increasing a little bit, but you should still be able to carry on a normal conversation. We call that the talk test. So if you can walk and say you're with somebody and you're carrying on a normal conversation, or you're talking to yourself like I do, then you can, tell if you're breathing okay. You don't want to be gasping for breath, and you don't want, you definitely want to increase your heart rate a little bit, and you still want to have a normal conversation, but you'll notice that your breathing is increased a little bit. And that's okay. If you're sweating too a little bit, that's fine too. So I appreciate you adding that falls prevention in, and
I love the talk test. That's very important. It just actually a little tangent. It just reminded me of when the first and last time I did a 10K with my sister, and we started the race, and she started talking, and I said to her, no talking, no talking at all. We're just running. We're running. So yeah, talk tests. If you can do a steady pace in a coordinated way and you're feeling good, you could still talk, that's good. But again, get cleared by your doctor first if you're not sure.
Yes, and it's always a good idea, especially if you have, a heart problem or high blood pressure, or you have eye disease. You always want to clear any exercise programs with your physician. It's really important. So what else they found, Debbie, with the study was that even not only decreasing your risk of diabetes up to 71%, and by the way, those were people over 60 that had the increase of lowering their risk up to 71% of type 2 diabetes by doing that, eating and the exercise and losing that 7% of body weight. But they also lowered their blood pressure. They also lowered their cholesterol. So not only do you get diabetes prevention, but you get improved blood pressure and improved cholesterol numbers, because the number one cause of death for people living with diabetes is heart disease and stroke. So it's really, really important to get your blood pressure under control and your cholesterol. So not only should someone who's diagnosed with prediabetes look for a diabetes prevention program, but also their doctor should screen their blood pressure, check their blood pressure, check their cholesterol, because if they are abnormal, they need to get those under control, because those can lead to serious problems if they do develop type 2 diabetes. So having the doctor put them on medication if need be, along with lifestyle changes to get their blood pressure and cholesterol under control, are very, very important as well.
So is diabetes only a public health concern here in the United States, or is this has it become more of a global problem?
Oh, no, it's definitely both. Actually are pandemic. So they're both global problems. Prediabetes and type 2 diabetes is definitely both a global problem. I think there's 460 million people across the globe that have type 2 diabetes. In the United States, we have, I think the latest numbers are 34 million people that have diabetes. And so that's 1 out of 10 in the US of adults that have diabetes, and then 1 out of 3 in the US that have prediabetes.
Wow. Wow. Wow.
Yeah, it's a huge problem globally. Absolutely. And, when COVID came, the connection between having diabetes and COVID was a huge problem because people who died of COVID, what they found out was that having diabetes didn't increase your risk of contracting COVID. But if you did get COVID, if you had diabetes and you were not in good control, your risk of complications and dying from COVID were much, much higher. I believe I read a study where 40% of the people last year in 2020 that died of COVID had diabetes.
Wow. I can see that. Just being a nurse for over 30 years and taking care of a lot of patients in the bedside. I did a lot of my career, focused a lot of my careers in med-surg nursing, and the patients who had diabetes had a harder time healing.
Yes.
And sometimes would have infections. And if we did get the infection under control, then, they'd go home, maybe go to rehab. Unfortunately, some come back with worsening of symptoms just because of that underlying disease of diabetes. It keeps the body from healing properly or at a normal pace. So it's a very, that makes sense to me. If they were diabetics and they got COVID, it took them a while. Maybe they didn't, make it because of that, but it took them a while to recover.
Well, there's a couple of things I can speak to in that, in the fact that when you have chronic elevated blood sugars, it's a great medium for infection to happen. And so the best way to prevent infections is to keep your blood sugar under control. Yeah. The other thing is when you have diabetes, it affects your immune system. So even if you get the flu when you have diabetes, you're not going to be able to, combat the flu as easily as someone who doesn't have diabetes, because when you have diabetes, your immune system is affected and you have more trouble fighting off illness. So that's why people end up in the hospital with their infections, because we only have about a third of the people that have diabetes that are actually under control.
Yeah.
It's such a low number and it's so scary. And I don't know if people understand the complications that come along with uncontrolled blood sugar. And I mean, really, we have eye disease, kidney disease, nerve disease, we have amputations, we have heart disease, we have strokes, we have cancer, we have Alzheimer's and dementia, hearing loss, we have fatty liver, sleep apnea. There are a lot of diseases that are associated with diabetes. So the most important thing that I could tell people when you have diabetes already, or you are diagnosed with prediabetes, you got to get the blood sugar under control. You've got to get the blood pressure under control. You've got to get the cholesterol under control. And that is a combination of lifestyle and medication. If that needs to happen, it needs to happen.
Yeah. But you know what? I again, in my years of nursing, sometimes I come across patients who believe, okay, so I've been diagnosed, and this is in their mind. They have the diagnosis of diabetes. They may be put on metformin, or maybe Micronase, or glyburide, or maybe insulin. And then they feel, okay, now I have a way to control my insulin or my blood sugar. So now I can eat whatever I want, because then I could just, especially if they're dependent on insulin, they could just kind of eat extra and then give themselves a little extra insulin based on their blood sugar. That is really not an advisable thing to do. If anything, it's going to worsen their condition, because they're not adding the lifestyle change. They're not being active. They're just relying on the medication to kind of help maybe cancel the diagnosis or the disorder that's going on in their body.
It makes me laugh when you say that. And it's not funny, but it makes me laugh because my dad had elevated cholesterol and he loved his donuts. And so he would go and he would eat his donuts and then he'd take his cholesterol pill. And he thought exactly that. I'm taking a cholesterol pill. Why do I have to deprive myself of having donuts? And so, that isn't really the goal. It's okay to have an occasional donut, but I'm saying that my dad was doing it every day. And he was thinking the pill was his like kind of, okay, I have taken a pill, so now I can have my donut. Like
Yeah.
you said, that's not really the goal. The goal is a lifestyle change. So, people that have a chronic disease want a quick fix. Don't we all want a magic pill? We all want a quick fix. We all want an easy way out. Well, when we have prediabetes, the way that we can prevent ourselves from developing type 2 diabetes is to really concentrate on what we're eating and exercise and getting our blood pressure and our blood cholesterol, and starting an exercise program and starting to make some small changes in our eating habits. Those are things that will help us prevent developing diabetes. Now, when we already have diabetes, there's no quick fix. It's a lifestyle change that we want to last a lifetime. And we don't want to be cut short on our life because we're not following our plan. Mm-hmm. When we have diabetes, there's a whole team there to help you. There's a diabetes education program, just like there's a program for people with prediabetes. There's a program for people with diabetes called the Diabetes Self-Management Education and Support Program. And so if you have diabetes, you want to go to that program. You've got a whole team of people. You've got certified diabetes educators. You've got dietitians. You've got psychologists. You've got pharmacists. You've got endocrinologists, which are doctors that specialize in diabetes. They're there to help you come up with a plan that works best for you so that you can live a longer, healthier, and happier life. So having prediabetes, what we need to do is we need to work on our lifestyle habits. When we have diabetes, we need to work with our team on our lifestyle habits. And yes, sometimes that includes medication. So,
yeah. So as far as food, I think you wanted to talk about saturated fats and what that means. But can you just let us know, for people who have are limited as far as finances go, when I think about, food choices and eating healthy, some people might think, oh, that might be expensive. Are you talking organic? Are you talking, what type of food are you talking about? Can I afford this? Is this realistic for me? Or somebody might say, I'm not a cook, or I live alone. How can I manage my prediabetes if I even if I wanted to?
So food is always the biggest challenge for any chronic disease, whether it's diabetes, heart disease, stroke, whatever chronic disease people are living with, food is always central to the treatment plan. When we're talking about prediabetes, the science shows us that it has to do with the saturated fats. So there's two types of fats that we have. We have saturated. So think about saturated fats as being saturated with bad things. They come from animal products or they come from our tropical oils like coconut oil. I know that's a shock to many of you because if you watch many commercials, they're telling you that coconut oil is healthy for you. I'm here to tell you that it is not healthy for you. So the tropical oils like the palm oils, the palm kernel oils, the coconut oils, and then things from four-legged animals, except for bison and venison, they're very lean, but we're talking about like beef. And so when we're talking about saturated fats, those are the ones that I call the bad fats or the unhealthy fats. They're the ones that will clog your arteries and they will lead to heart disease and stroke. So we want to have less of those and more of the healthy fats, which are called unsaturated. So think of saturated as being saturated with bad things that will lead to disease. And then unsaturated are healthy fats and they don't lead to disease. And we want more of those and less of the bad fats. So examples of unsaturated fats would be olive oil. Think about the Mediterranean diet. The people in the Mediterranean areas, they're very lean. They eat a lot of olives. They eat olive oil. They eat a lot of seafood, nuts. So those are more of the healthier fats and versus the saturated. Now, there's another type of fat that is actually the worst fat. It's called trans fats. Trans fats are when they actually take a healthy fat, which is the healthy fat or the unsaturated. They're usually liquid at room temperature, where a saturated fat is usually solid at room temperature. They take a healthy fat and they actually add hydrogen to them, and they make it the word hydrogenated. So I don't know if you any of the viewers or label readers, but if you read a label that says partially or fully hydrogenated, that is one of the worst type of fat, because they're literally taking a healthy fat, adding hydrogen, and making it last on the shelf forever. So I'll give you an example. Think about the little cups of milk that are, the little containers of the milk. So they're not really milk. They're really like, what are they called?
Is that the half and half you're talking about? The little...
Yeah, but it's not that. It's like the imitation ones. It's like all the chemicals. It's really not. It's the dairy creamers, the non-dairy creamers.
Yeah.
So think about them. They're in a box, in a warehouse. They need to last forever on the shelf. Those are not healthy, because if you know about dairy needs to be refrigerated, right? So if we're putting something in a warehouse in a box that's supposed to be like dairy, we have to put something in it to make it last forever. Those are not healthy for us. Salad dressings actually have a lot of trans fats in them. Pies, cookies, cakes, those kind of things that are made, crackers. Think about how long you can keep crackers in your cupboard for. So anything that you can think of that you can leave in your cupboards for long periods of time probably have hydrogenated fats in them, and those are the worst fats for you. So if you looked at a food label, under fats on the food label, if it says trans fats, you never want to buy that or eat them, because those are the worst fats for our body. So that's one thing to look at. Saturated fats, if you're reading a food label, I always tell people, Debbie, to not look at how many grams, because that doesn't mean anything to anyone. If you look at a food label and you look at over on the percent of daily value, it's that little percent sign and it says DV. If you look under saturated fats, 5% daily value per serving is good. If you get up to 20%, it's not good. So if you're looking at, how do I know if this product that has saturated fat in it is good for me to choose? I would say go to the back of the label, look under the fat on the label, and the word saturated fat is going to be listed. Look under the percent of daily value, and if it's less than 5%, you know it's good. I actually have something I'm going to show you. Let me grab it.
Okay.
It will help you. So I've got this coconut oil. Remember I told you that coconut oil isn't really good for us? We think it's good for us, but it really isn't. So I'm going to flip the label around, and I don't know if you can see this really well, but under total fat, the first word is saturated. And if I go over to the percent of daily value, it's 65% daily value in 1 tablespoon. Now, when you're looking at that, less than 5% is good. Greater than 20 is bad. This is 65% per 1 tablespoon of saturated fat. So that is not good for us.
Wow. All right. So all I keep thinking about is the holidays.
Yeah. The holidays.
What a beautiful spread of pies, dessert, gravy, turkey. I don't know what people serve, ham, maybe prime rib, cookies, how can people with prediabetes or people with diabetes, how can they not survive, but thrive, or feel like they can still participate and enjoy the holidays despite the saturated fats or the calories or, the sweets? What can you give us some direction on how we can kind of encourage people or motivate people to really come away and enjoy their holidays and not feel guilty? Because sometimes when we feel like we kind of went off the bandwagon and jumped off our diet or did something we weren't supposed to, sometimes we kind of start creating worse habits,
Yeah.
So, and then we wait, then we say, I'll just wait till the first of the year. That'll be my New Year's resolution. I'll eat better. I'll just kind of, go off the wagon during the holidays. What is the best way to kind of help support people with diabetes and prediabetes?
Well, that's a loaded question. So first of all, people with prediabetes, the biggest thing you want to remember is you want to lose that 7% of your body weight. You want to watch how much saturated fat that you're eating. So you're going to eat less animal products. You're going to eat more two-legged animals without the skin. So think about it. Thanksgiving turkey. I remember when I was a kid, Debbie, and I remember that we all fought. There were 8 of us kids, and we all fought about getting the skin off the turkey as soon as it came out of the oven, and then you lift it up and all that grease is dripping out, right? But as a kid, that was the best part. So when we're thinking about prediabetes in general and healthy eating, skin of chicken or turkey is where all the fat is. So we definitely want to be not eating the skin of the turkey for Thanksgiving or Christmas, because that is where all the fat is. And in general, we should be eating more chicken, more turkey, and more fish, especially the fatty fish, because it's good for our heart and our brain. And it gives us the omega-3 fatty acids that we need. There is a great tool. So I'm going to talk about the holidays in a minute. I just want to talk about kind of general healthy eating, and then we'll get into the holiday eating.
All right, good. Because this hour is flying by. We only have about 10 more minutes left. I can't believe it.
Oh my gosh. So I have this plate.
I need to have you back. You have to come back, right?
Okay, I'll come back. Yeah. So here's this plate. It's called My Plate, and it really helps us to come up with how we should fix our plate. It's a 9-inch plate, everybody, not an 11 or 12-inch plate. It's a 9-inch plate. It's divided in half. We've got our fruits and our vegetables. And then on the other side, we've got a lean protein. So that is our beans, our lentils, our peas. It's got our nuts, it's got our seafood, it's got our chicken and turkey without the skin. And then we have our whole grains, 100% whole grains. So those are our crackers and our breads and our cereals. And we wanted to say 100% whole grain. And then we have our low fat dairy. So this is how someone with prediabetes should be eating all the time. Now, when we talk about the holidays, this is what I'm going to say about the holidays. The holidays are a special time of year, and it's a time of traditions. And there's certain food that we connect with only eating during the holidays, like pecan pie for me. Mm-hmm. And so this is the situation. Whether you have prediabetes, whether you don't have diabetes at all, or you have diabetes, there's something that you always want to preserve are those traditions, and you always want to preserve those memories, and you want to feel like you're part, and you don't want to deprive yourself. So my recommendations are a few of them. Eat before you go to a holiday celebration. I know that sounds crazy, but if you're going to a holiday party and you're starving, it's like going to the grocery store hungry. You're going to buy all that stuff that you normally wouldn't eat because you're starving. Have something to eat before you go to a party, because then you're not going to be as hungry. Make it about the people there, not about the food there. When you're looking at all the choices, don't put anything on your plate till you've kind of scoured out what there is, so that you make sure that when you do pick something, it's going to be worth picking that, because you've worked so hard all year, and now it's the holiday season, and it's not just one party. It's multiple parties, it's multiple celebrations, and it lasts from Halloween all the way to the new year. So that's a lot of time that you can sabotage everything you work so hard for. So take a look at everything and make good choices. Make some swaps. So if you know you want to have that piece of pecan pie, it's okay to have the piece of pecan pie if you're going to have a smaller piece. And savoring, mindful eating. Debbie can tell you more about that. Eating mindfully, taking the time to really enjoy the taste of eating and enjoying that. Even though you're having a smaller portion, you're not depriving yourself, but you're still getting what you love. But now when you think about having that pie, you're thinking about, well, what else am I going to put on my plate that is going to counteract the pie that I'm having? So we're going to eat more vegetables. We're going to eat more whole grains. When we pick our meat, maybe we're not going to pick the prime rib. We're going to go with more of the turkey or the chicken. So we're going to kind of make some swaps in our general food of what we're eating at the buffet or the party and the appetizers, so that we can indulge with that special dessert that we want to have. We want to make sure we're drinking plenty of water, because water will fill you up. We want to make sure we're eating something beforehand. And an apple has pectin in it, and it curbs your appetite. So that's another thing you can have before you go to your party. I would offer to bring something that you love, maybe a dessert that you love that you've made not so decadent, but it's still delicious. And you've maybe done some recipe swaps. And that way, you know that if there's no dessert there that you feel like you can eat, you brought something that you can so that you can enjoy. That's another thing. And you know what? You got to get your exercise in because we know we're going to be eating a lot more food. So we have to counter the extra calories that we're going to be eating with continuing our exercise program. So we really have to make our exercise program a priority. Grabbing a smaller plate instead of getting the bigger plate, go for the appetizer plate, and putting less on our plate. If you have diabetes, you have to be conscious of the high carb foods. And those are, the crackers and the cookies and the breads and the stuffings and those kind of things, and the high carb vegetables, which would be your winter vegetables. So you want to pick more of the salads and the broccolis and Brussels sprouts and things like that versus the potatoes and the squash and things like that. You can have them, but just take a smaller amount and have more of the non-starchy vegetables. And then really checking your sugar more closely are really important. So
I think you really mentioned something that, I haven't really thought much about, but really is a part of the holiday season. It's not just the food,
yes,
but also the people that you're with.
Yes.
So, maybe adding that particular element to how we approach the holiday season is going to be really a smart way to enjoy not only the food, but also the company that we're with. So, and perhaps not my family, we love to fill up the whole table with food. I mean, I love food. But the thing is, what happens is we kind of congregate around the dinner table, yes, or the kitchen table. And then yes, before you know it, we're grazing and grazing and grazing. Yes. And we come away feeling really full. So perhaps grabbing what you want to eat and maybe going to a different room and start conversation and connect with people that you haven't seen in a while is a good way to have your cake and eat it too without feeling guilty. Right. So definitely a good way to do that. And mindful eating, like you said, is very important because it's just a way for you to really savor whatever it is that's in your mouth in that particular present moment. So we are actually at the very top of the hour. I can't believe this.
I can't even believe that. That is crazy. I am so happy. I know we talked about a lot of things, and I'm so grateful that and thankful for being your guest today. Thank you so much. And I hope that some of these little, helpful hints help you to prevent diabetes and manage your diabetes if you have it already a little better.
And so, Shari, I want to thank you for being on the program, and I definitely want you to come back. How can people learn more about you? And so if you could just give us, a website, or how can people learn more about you and any other resources that you might offer?
So I'm a keynote and educational speaker. I specialize in prevention and management of type 2 diabetes and type 3 diabetes of the brain and brain health. I offer courses for healthcare professionals as well as community organizations, as well as corporate wellness. And on my website are all my programs. And, I also had terminal cancer. And for me, I know what it's like when you don't have your health. Your health is your greatest wealth. And so I want to make a difference in the life of one person every day, because we never know when we get that call that changes our lives. And so we want to be, in the best health that we can all the time. So you can find me and my story and my courses on diabetes, carewithak consulting.com. And feel free to reach out to me. There's a contact page where you can send me a message. And my email is also diabetescarewithak@gmail.com. So I look forward to coming back on your show. Thank you so much.
I want to thank the Quincy Public Library, Quincy Access TV, and those of you who joined us today. Thank you so much. This is Debbie Lynn Toomey from Tufts Medical Center.